Hi, I'm Katie DeLeo. I've been a cardiovascular nurse for 40 years. Today I'm going to instruct Colton here how he can prepare himself for his cardiovascular rehab workout. Colton has gone through his interview and is signed up to start his workout program next week. So I will now show him how to apply his electrodes and heart monitor. This way we can do an electrocardiogram for the entire time he's here. You'll find this equipment in our locker room. We have the Nuprep, the pouch, the 4x4s, the electrodes, and our heart monitor. So we're going to start with the pouch because you're going to learn how to put this on yourself before you come into the gym to do your exercise session. This is the monitor. On the right hand side there's a transmitter number. You'll want to remember to tell whoever's behind the computer. Put it in your pouch. The easiest way to do this is we're going to put these electrodes on the wires instead of the skin right off because it will be discomfort on your sternum. And they snap right on. So where I'm going to put them, I'm going to put one here, one here, one here, and one here. Okay? So the next thing you're going to do is take the Nuprep. Just a little bit will do. If you put too much gel on, then these electrodes are going to slide around and then we're not going to get a pretty electrocardiogram. So, you wipe it off here, turn it over, wipe all the gel off, otherwise they'll slide around. And over here. Then, on the top of these wires, I'm going to take the black and the white. RA, right arm. I'm going to take that seal off. I'm going to put it right where you washed. Push on it just a little bit so we have a better contact. This one is LA for left arm, or what we consider the left arm. And then we're going to go down here on a rib. It's nice and stable there. Turn it over, wipe it off. And on this side. And wipe it off. I'm going to take these two. LL for left leg. And if you put these on wrong, we'll know when we put you on the computer. Okay, now you can go ahead and tie this behind your back. That's what keeps our pouch stable and the monitor stable, so we get a good picture. Okay, so when you come in to do your exercise session, you'll go into the locker room, and this is what you're going to do. All of this information will be in the locker room between the mirrors. I've shown you how to put on electrodes for cardiac rehab. A cardiac rehab patient is a repeat patient, so there's value in training the patients to do their own electrode prep and attachment. The prep I demonstrated is the same for stress test or Holter monitoring. It's the exact same as what we went through with Colton. The only difference is that there will be a different number of electrodes. In the case of stress test, the nurse will apply 10 electrodes. In the case of a stress test or Holter monitor, the nurse does the prep and applies the electrodes rather than the patient. In stress test, the doctor will come in and the stress test will start. It will continue until a target heart rate is reached or there are changes in the electrocardiogram that would indicate ischemia. The prep is the same in all cases. In the case of Holter monitoring or stress test, it's just done by a nurse rather than the patient doing the prep work themselves. I'm Katie DeLeo, and thanks for watching.